Aloha, and welcome to our second episode of Talk Story with House Majority. My name is Della Belatti, and I serve as a House Majority Leader of the 30th Legislature of the state of Hawaii. This weekly webcast is designed as interviews with state executive leaders, community spotlights, and talk story conversations with my Democratic colleagues in the State House of Representatives. Today's theme is health and food security, two important topics as we head into the week 6 of the governor's stay-at-home orders. And just as a start, all of you out there continue to do your part to flatten the curve. Mahalo. Today, I will be joined by Dr. Melinda Ashton, Chief Quality Officer of Hawaii Pacific Health, that has hospitals and clinics across our state. Dr. Ashton, welcome.
Thank you.
So before we get into it, Dr. Ashton, can you tell us about Hawaii Pacific Health's healthcare footprint across the state?
Sure. We have 4 hospitals. We have Wilcox Medical Center on Kauai. We have Palimomi, Straub, and Kapiolani here on Oahu. And we have clinics scattered across the state.
So one of the reasons why I wanted to invite you is that I know that you are part of a team of physicians across the state representing the major hospital centers, representing all of the kind of specialties, pediatricians, OBGYNs, primary care doctors, also doctors and physicians in our long-term health facilities. You folks on a regular basis consult with Dr. Sarah Park, our state epidemiologist, so that the state really has a way of knowing what's happening outside there in the community. Is that accurate description?
Yeah, that's correct. We've been meeting now as a group for several years, actually. It wasn't in response to this pandemic, but over the years, we've had a number of issues that we talk about and we confer on. So Dr. Park gives us information about what Department of Health is doing, and we give her feedback about how that would be implemented across the state or what our impression would be of whatever the issue of the day is.
So that's really turning out to be a strength of Hawaii, this kind of close collaboration. And so, take me back to the initial start of all of this. February 26, 2020, the US has news of the first confirmed death from coronavirus in Seattle, Washington. What was happening here in Hawaii in our hospital community? And what was HPH doing in order to prepare? And what were the other hospitals doing to prepare?
Right. It seems so long ago now, and we've learned so much since then. It's really actually hard to go back and think, what were we doing? So what I did was I went back and I looked at all of our timeline and our notes of the activities that we had at HPH. And so actually it was the day after that we did our first HPH corporate emergency management meeting, where we gather the leaders across the system and say, hey, we think we've got something to worry about. Normally it's used for tsunami or earthquakes or that sort of thing. But for this, it was, things are not looking so good out there in the world. Think about China, think about Italy. We need to be prepared. We need to start planning. So that was the first of our meetings. We did that several weeks in a row. And then we said, okay, this is big. And so that's when we actually set up what we call our corporate command, where each of our hospitals and the HPH system, we've actually been in command centers, in rooms with key leaders in each of those areas so that we can talk to each other all day long. And it's 7 days a week to make sure that we're responding to whatever the issue is that comes up. So thinking back to the end of February, it's a long time ago, we were well aware that these events were occurring around the world, and then we began to plan on how we were going to respond.
So for the hospitals in particular, and I think this is important for the public, when we talk about flattening the curve, what does that mean for the hospital system?
Right. The issue with this pandemic is that no one in the world has had this virus before. So it means that any person is susceptible. And we know that 80%, or in Hawaii, 90% of people that catch this virus don't get very sick. But there are a number of people that get very, very sick. And what the problem is everybody gets the infection at the same time or within a very short period of time. The hospital system gets overwhelmed. There aren't enough beds. There aren't enough intensive care unit beds. There potentially wouldn't have been enough ventilators. So we're all capable of responding with the kind of care that these patients need, but we can't do it for everybody at the same time. So flattening the curve means having fewer people get the infection at the same time and spreading it out over time. And really, one of the goals is to spread it out long enough so that we have a vaccine or we have an effective treatment so that not everybody will end up in the hospital needing those beds.
So what Dr. Park has been saying in the public is that this is going to be a marathon, and we're really in the first phase of it, and that the stay-at-home orders were really important. So this is a coordinated effort on the part of hospitals, the healthcare system, state leaders, but then the public has its part in staying at home and helping flatten the curve. So from your perspective, while the public has been able to stay at home, what has been the effect of that in terms of how is it translated into what's happening at the hospital level?
What it's done for us as hospitals, it's allowed us to take really good care of those patients that have had the infection and other patients that need us for various reasons, and without getting overwhelmed. We haven't had that same scenario that we've seen so many other places around the world where there are, makeshift hospitals that have to be stood up and doctors and nurses dropping from infection. And we haven't had any of that. And so the activities of all of us have been very effective. But what that means is we've got a large amount of the population that hasn't had the virus, and we don't want them to get it. So we have to continue to be careful.
And so what we've seen is, again, our numbers. Every day, I think everyone anxiously watches what those numbers are. And I think today we only have a couple more cases, so we're up to maybe 611 positive cases. So as that continues to happen, there's this call and this urge to open up. Do you think we have the stronger capacities within our acute care setting? And what does it mean as these numbers continue to remain low? What does it mean for the gradual reopening of the healthcare system, if you can expand?
Right. I think the sustained low number means that we are in a place where we could begin to open up a little bit and begin to provide some of the healthcare that's been deferred, but also know that we still have capacity. So as we open up, what happens is more people are in contact with more people. And so if there is a virus in the community, it spreads. And as it spreads, some of those people will need healthcare in hospitals. And so as long as we do that gradually and pay attention to how it's working, we will have capacity to continue to care for those patients.
And within the healthcare setting, one of those gradual reopenings, if you can speak a little bit about the elective surgeries and elective procedures, what should the public know about that gradual reopening?
Right. So one of the things that we stopped doing back in the middle of March was in order to make sure that the hospital was ready for a possible surge of patients, we said we've got to make sure that we're not taking up beds with things that we could avoid. So patients that had surgeries scheduled suddenly had those surgeries canceled. We've continued to do urgent surgeries. So if someone's got something that has to be done right now, we'll do it. But we've put off everything else. And that means that there are patients out there potentially with some forms of cancer that need surgery or other kinds of things that could wait, but they can't wait forever. And so we're going to begin in the next few days, starting to have those patients come in and have their surgery. All of the hospitals are looking at how to do this responsibly. We want to do it gradually. It's not open the doors and have everybody come back, but begin to have those that are most urgent of those that were deferred begin to be performed. And keep an eye on how many of those patients end up needing a hospital bed, how many don't, where are we on our capacity, so that as we begin to open up other parts of our life, we want to make sure we've still got the ability to take care of patients that need us.
So really important, you guys have eyes on what's happening in the hospitals. What are your thoughts on the reopening of the local economy first, and then the reopening of the tourist economy? What are we going to need to be able to do these gradual reopenings?
I think we need to continue to monitor on a daily basis the way we have been, the number of patients that are testing positive. I think we all feel that if we open the local economy, the risk is relatively low. There's very little disease that we can identify in the community right now. So we think that opening up the local economy gradually makes a lot of sense. We all know, I think, that the risk is as we begin to invite visitors back, that some of those visitors will potentially have this virus, and we'll begin to see more small outbreaks. And we need to be very good at identifying those quickly with testing and tracing them, and then helping people to be isolated or quarantined appropriately so that we don't end up with a, explosion of illness.
So I want to remind our viewers, if you'd like to post questions in the facebook.com /Alelo community, please do that. We have Dr. Ashton, who's a wonderful expert in this arena about what's happening in our healthcare system broadly. If there's no questions, then what I would like to maybe ask Dr. Ashton is that what advice would you give to the public about what the new normal will look like within hospitals and across healthcare facilities, not just hospitals, but our long-term care homes?
Well, I think long-term care is going to be very careful to be monitoring visitors, limiting visitors, continuing to be careful about who they allow into their care facilities, monitoring their employees. And we've been very fortunate that we haven't had any outbreaks in our long-term care facilities, and I know they all want to keep it that way. So they're going to be very cautious. As far as the new normal in healthcare, we're expecting that at least the immediate term new normal is going to be that we will limit the number of people that we see. We are really happy with how well virtual care or medicine done over telehealth has worked out for us and for across the state, actually. And so we're very interested in making sure we maintain as much of that as makes sense. We know that we can't do everything by telehealth, but we can do a lot, and a lot more than people thought. And so I think the new normal will include a lot more telehealth than we had prior to this pandemic. And I think we'll see that waiting rooms won't be popular at all. We're going to be trying not to have people sitting in waiting rooms. We don't want that within 6 feet for long periods of time kind of contact. We want the physical distancing to continue.
I'm really happy you bring up the topic of telehealth, because I think we are seeing an explosion, and it's going to really help our rural patients, but even, just patients across the board who are really busy and want to be able to maybe just call in and quickly consult with a doctor or a healthcare provider. I think on the policy side, we in the legislature will also have to examine telehealth policies and how we can support those efforts. So I know, again, this sense of collaboration. I know that the Department of Health is really leading the charge on the telehealth pilot program. We're wrapping up on our piece, Doctor. Is there any last minute final message you'd like to provide to our members? And before I do let you answer that, I just want to say it's been so amazing to see the recovered patients coming out of your institutions, out of Tripler, and then also to see the amazing people working for you. I just want to give a shout out to Dr. Morel Ver with Polymomi, who's been just a leader in the Filipino community and in the broader community at large. You folks have really been leading the way. So any final messages, Dr. Ashton?
I think the final message is that we're very grateful to the entire community for following the rules, staying home, really being responsible about what this has all been. And it's not been easy for anybody. It's hard for the healthcare workers too. They are nervous. They are worried. We've really been very pleased that we've been able to get through this without any issues with our healthcare task force. Being able to provide all the appropriate PPE and so forth has been really, really good for us. We've been happy about that. But I think really just everybody in the community has done their part, and I expect that we'll continue to see that.
Well, thank you again to Dr. Ashton from Hawaii Pacific Health for joining us today on Talk Story with House Majority. Now, as we're going to transition, we want to look to our Community Spotlight segment with Brian Miyamoto and the Hawaii Farm Bureau.
We started this because, when some farmers markets of ours had to get closed down, our farmers really came to us and was like, we have no other place to sell. And a lot of these this is their income. This is how they pay their bills, their water. This is how they keep farming for their seeds. So we needed another outlet to let them farm. They research other states of what they're doing. So they initiated, drive-through farmers markets. So this is where, I contacted them, got their ideas, got their feedback, and that's how this baby came along.
So, Farm Bureau, we represent all farmers, large, small, medium, organic, conventional, biotech. And, this coronavirus has hit everyone here in the state of Hawaii. Farmers and ranchers are no different. A lot of their retail outlets or retail markets are shut down. Tourism has essentially disappeared. 240,000 people a day that we're eating our local produce, our local goods. Restaurants have either shut down or scaled back. A lot of our restaurants are buying local. Farmers markets have shut down. There's still some that are open, but a lot of them have shut down. This is where our small farmers are really selling at the farmers market. As everybody knows, we import 80 to 90% of our food. If we do see an interruption, we need to ensure that the farms here are continuing to produce. In order for the farms to continue to produce their food, they need to make an income. In order to make an income, they need a market. They grow their products, and a lot of it came really quickly. So we had a lot of food that was harvested we didn't have any place for. That's one of the ideas behind this farm to car. Again, a different market for our farmers to sell. They need income to buy seeds, fertilizer, pay for their water, pay for their leases, pay for gas for their tractors, pay the labor. What we're trying to look for here is keeping capital in the farmer's pocket so that they can continue to farm. If the farmer don't have access to capital right now, they can't replant. That means a month or two when this is all done, hopefully, or when it goes down, we're not gonna have the crops here. And if we do see the disruption to the food supply chain coming from the mainland, our shelves are gonna be a little bit bare. It's frightening right now to see, when you go to the supermarket and you see empty shelves or bare shelves. What's more frightening? Empty fields. A lot of our farmers are finding that they don't qualify for unemployment insurance, so as other businesses are able to take advantage of this type of system, our farmers are finding it hard to get access to some emergency capital they need to continue. That's why we're doing projects like this, to get money into their pockets.
People can go to the Hawaii Farm Bureau website, that's hfbf.org. There's a Farm to Car tab, and it'll walk you through everything, how to get to our store. So our store is currently closed, but we'll always be opening Thursdays for the following Wednesday pickup, and then Sundays for the Saturday pickup. Mahalo, Farm Bureau.
Thank you to the Hawaii Farm Bureau and Brian Miyamoto for participating in our community spotlight this week. Joining us now, we have Representative Onishi and Representative Kitagawa. Thank you for coming onto our show. Representative Kitagawa, you have some wonderful news for us. What do you have to share with us?
We do have some wonderful news. So myself and Representative Scott Matayoshi, we are starting the Farm to Car program at Windward Mall starting tomorrow. So we've been working with the Hawaii Farm Bureau as well as other partners such as Kamehameha Schools, Windward Mall, and Alexander and Baldwin to be able to expand the Farm to Car program that's started at the Blaisdell, and we'll be starting it at Windward Mall tomorrow. So last week, our community as well as other people who are interested in the Farm to Car program had the option to go online and purchase produce boxes, set produce boxes that will be distributed tomorrow. So for this first run and extension that we had about 140 orders of produce boxes. So it's a little bit different than what the Blaisdell does, because the Blaisdell, although they have some set produce boxes, they also do this kind of grocery shopping cart option where people can pick and choose different items. Our program right now at Windward is just the produce boxes. We are looking to expand to include Windward farmers, so that is in the works right now, and hopefully within the next week or 2 weeks we'll be able to have additional boxes up that'll be filled with all Windward farmer products. So we're really excited about that. And we really wanted to bring this to our community, not only because it supports local agriculture and our local farmers, but because we also know that people are looking for different options as a way to get healthy products and healthy food for their families. So sometimes people still don't want to go to the supermarket, or they might not want to go to the farmers markets that have been sort of popping up around the island because, there's still sometimes concerns with social distancing. So with this Farm to Car program, they can simply drive on up. They don't even have to interact with us. They can just show their number through their window, and we just put their items in their trunk. So it's just another option for our community to get that healthy food that they need.
So you really had to work through a couple of challenges. Can you speak a little bit about the challenges of connecting with Windward farmers and how you're overcoming that?
Yeah, so windward farmers, unlike some of the other farmers, are usually smaller. So they don't have as much capacity to do, these really huge orders like some of the other farmers that are participating at the Blaisdell and the other farmers that we used for this first week of the Farm to Car program. So what we're trying to do right now is working through Kamehameha Schools, who has a lot of contact with the windward farmers, as well as Rep. Matayoshi and myself reaching out to farmers that we know in our communities to see if they can form a co-op, if they can form a group that can come together to put these produce boxes together. We're also looking at figuring out other ways to get them involved. So as we continue to do this throughout the stay-at-home order, we're planning to expand the program to try to meet the needs of our community more, but also to continue to support our local farmers.
So we're really lucky to have here today Representative Onishi from the Big Island, who actually has kind of a bird's eye view of kind of the diversity. So what's happening in Windward is different than from what's happening on Hawaii Island. Welcome, Representative Onishi. Can you give us a little bit of update on what's happening on the agricultural scene from the federal perspective?
Yeah, well, thank you, Della. First of all, there's a lot of programs that are being done at the federal level to help farmers and ranchers. Really quick, I wanted to go over the coronavirus food assistance program, which is being run by the USDA. That was recently announced in April 17th. We have more information for farmers and ranchers and nonprofit organizations on the availability of funding. USDA was provided $16 million, $19 million in total, $19 billion, 16 of which is direct support to farmers and ranchers, 3 billion USDA purchase and distribution, which is for the purchasing of $100 million per month of fresh fruits, dairy products, and meat products. So all three of those categories have $100 million per month being spent. We also have Section 32 funding, which is for distribution to food banks, Family First Corona Response Act, and Corona's Aid, Relief, and Economic Security Act, which provides $250 million, 600 of which goes directly to food banks to purchase food. The USDA has increased the SNAP benefits about 40% more than what states were getting. And Hawaii was approved on April 17th to receive that additional funding. And with the latest action by Congress, farmers and ranchers are now available to apply for the PPP and the EIDL, the Emergency Disaster Loans, which they were not eligible for on the first go round.
So we have our first question from a viewer, Alan Smithy, I believe from urban Honolulu. This is for you, Representative Onishi. With the many mainland closures, along with scaling back on staff in food supply chains, I think that he's referencing, the closures on the meat packing places. What steps is the state taking to ensure continued food supply in Hawaii?
So most of the impact has been recently on meat producers. Well, not so it's beef, poultry, and pork. As many of you know, the president has utilized his emergency powers and is going to be providing those businesses with additional federal support in order to provide employee protection and sanitization of these facilities to try to keep them in operation. Um, Again, there's not a lot that can be done because it takes a lot to stand up a meat processing facility. So getting these sanitized and getting employees protected and putting protective equipment in those are paramount and is a priority to continue to supply the public with fresh food, especially meat. And in Hawaii, though, we do have capacity for some beef slaughtering on every island. Generally, they are near capacity, but we're lucky because we also have fresh meat available. We have a fairly large live cattle livestock industry, so we can, utilize that to help fill in the gaps where we are unable to bring in food from the mainland.
So it's really important for the state to be supporting. And I really appreciate this question about food because it's not just plants, it's proteins. So we have a very active fish industry that we need to support, the cattle ranchers, as well as the agriculture, food agriculture, plant agriculture. What is the state doing in terms of any kind of grant programs? Richard, can you shine a light on some of that?
Yeah, so the State Department of Agriculture has three programs which they currently are um, that they currently have in place. The first one was a grant program, $250,000, which was taken from funds that are received from the shipment of oil to Hawaii, called the Barrel Tax Fund. They provided um, 96 grants throughout the state. Uh, 86 farmers and ranchers received $2,000 each. And 13 nonprofit agriculture organizations were granted anywhere from $4,000 to $10,000. This was distributed throughout the state. Every county had a share of farmers and ranchers that were granted. Um, they also have other programs. They have an agricultural loan division, which has emergency agricultural loans. These are loans up to $150,000 at 3% interest. They also have a microloan program, which
Mm.
provide funds for loans of less than $25,000. So they have these three programs that are currently being run. Many of the farmers and farmer organizations, farm ranching organizations, know about these programs, and hopefully the farmers and ranchers will be taking advantage of these.
So we really have to connect farmers, producers with all of these programs that to help. But I want to cycle back because this question is really about how do we support each other and support local. In some of the conversations I've been having with people offline is that we almost have to have a hyper local campaign because we now know that we're going to open up the local economy first. We really want people to support local. So the efforts going on in Representative Kitagawa's community is super important. And I know, Richard, you have stuff going on in your Hawaii Island communities. I'm going to conclude and wrap up for each of you. As we move forward, as we head towards May 31st and the end of the stay-at-home orders, hopefully we're still going to be opening up gradually. What would each of you like to see as part of Hawaii's better normal, the new normal? If I can ask you first, Richard, what would you like to see as part of Hawaii's better new normal?
So, as a member of the House Select Committee on I guess, the response to our economy and how we're going to build it, the one thing that we really need to look at is more information on what Hawaii farmers are raising, what their markets are, and how much actual produce and meat and food are we importing? Hawaii has 1.5 million people. We used to have, on average, about 300,000 guests every day. So, that's not even 2 million people. So we have a small chunk of the food pie in the United States. So we're going to have to fend for ourselves. What we're finding is we don't have the commodities being grown in Hawaii to really feed people in mass. And I think Representative Kitagawa mentioned a little bit about that, how we have a bunch of small farmers, but to ramp up production in a time like this, it's very difficult. So we need to look at that and try to move that discussion forward and talk about that and how the state is going to help support farmers and ranchers to get this done.
And I think we're doing that in the House Select Committee. Throwing it to you, Representative Kitagawa, what would you like to see as part of Hawaii's better new normal?
Well, I definitely agree with Rep. Onishi, about looking at farmers and really diversifying our economy. We're really focused on tourism. And so looking at what other industries can we start to focus on to try to diversify our economy as we move forward after, COVID-19. But I think on more of a personal note, what I've noticed and what I really appreciate is there's a lot of positive that's coming out of this time right now during the pandemic. Really, communities are coming together, people are coming together, people who have maybe never volunteered before or never even met their neighbors are now reaching out to other people, are now helping, are now providing that support to each other. So if I had an ideal of what a new normal would be, a better normal, I would hope that that kind of compassion, that kind of patience, that kind of giving nature that we've seen throughout this entire situation would continue on, that we would become, friends with our neighbors, that we would get to know our community, that we would not just depend on government or on certain agencies to do what we need to do in our communities, but we would step out ourselves. So I'm hoping that positive thing that's come out will continue as we move forward after this pandemic.
Thank you, Representative Kitagawa. That is an absolutely positive note to end on. Thank you, Representative Onishi, for joining us. And thank you for tuning in today for our second episode of Talk Story with House Majority. Please follow the House Majority on Facebook, Instagram, and Twitter at Hi House Dems for the most recent updates. You can also visit our new website at HawaiiHouseDemocrats.com, which has resources all about COVID, press releases, and valuable information on how the House Majority is responding to this COVID pandemic. We'll see you next Wednesday. We're going to have some exciting guests with Attorney General Claire Connors and Dr. Sarah Park. See you next Wednesday on Talk Story with House Majority. Aloha.